I ask my patients this one question, and they literally freeze. Is there anything else bothering you? Anywhere in your body that just feels off? And they pause, not because they're unsure, but because no doctor has ever asked them that before. See, they're used to questions like, what's your diagnosis? Do you have your MRI results? What did your last doctor say? But when I ask how their body actually feels, they look at me almost confused, like they're thinking, wait, you actually want to know? Here's what's happened. The more they've been to doctors, the more they've learned to trim down their story. They've been trained to give just the relevant data, not every detail, especially here on the Upper East Side of Manhattan, where I practice. My patients are city folks, they're New Yorkers. No frills, straight to the point, all about efficiency. Some tend to think there's no point sharing symptoms that don't lead to prescriptions. Others might have been cut off mid-sentence when they tried to elaborate and learned it the hard way. Or they simply don't think medication is necessary for those minor symptoms seemingly disconnected to the main issue. So now they hesitate. Should I mention that I've been sweating in my sleep? Do I talk about my loose stools? I have this weird itch around my ankles, but that's probably not related, right? That pause? They've been trained to ask themselves, does this symptom deserve to be spoken? Now, doctors aren't to blame here. It's the system of conventional medicine that shapes our interactions in the exam room. In conventional medicine, doctors are trained to ask very specific criteria-based questions. Do you have acid reflux? 2 or more times a week? Is the pain sharp or dull? On a scale of 1 to 10. They're trying to fit symptoms into known categories, diagnoses they can treat. But here's the thing. If your symptom doesn't quite fit, it's often seen as irrelevant, or worse, ignored altogether. So patients start to self-censor. They think, well, my doctor doesn't need to hear about my itchy skin, or my loose stools, or how I can't sleep through the night. That's probably not related. And eventually, people stop telling their full story. But in my clinic, I get to ask again, is there anything else bothering you? And I mean it. I'm not limited by diagnosis code. I'm not rushing to check a box for insurance. I'm here to find patterns, the way your body is trying to communicate with you. So even if your symptoms seem small, strange, or disconnected, to me, they matter. Because they always lead somewhere. Let me tell you about a man in his 60s who came to see me. When I asked what brought him in, he immediately started listing off his conditions. I'm on blood pressure medication, and I've had diabetes for about 10 years now. My recent lab work came back showing high cholesterol, and I'm seeing a urologist for an enlarged prostate. The size is small to moderate, so we're just monitoring it for now. All important information, and I made sure to note everything carefully in his chart. But then I asked, okay, so what actually feels hard in your daily life? What symptoms are making you uncomfortable? He looked at me, genuinely confused, like no one had ever asked that before. So I clarified, not just what your doctor's diagnosed, what do you actually feel in your body? That's when he paused, thought for a moment, and said, my head feels heavy. I'm always tired. I wake up multiple times at night to pee. I feel restless, like I can't settle, and I don't sleep well at all. Now, that was something I could work with. I prescribed a herbal formula tailored to those specific symptoms he was experiencing. Within a few weeks, he was sleeping better. The night urination improved. He felt calmer, less anxious. Even the fatigue started lifting. Now, here's what's important. I did not set out to treat his hypertension, diabetes, or enlarged prostate, though knowing his diagnoses helps. When I just follow what his body is saying, it leads to a larger pattern that reveals his unique health concerns. See, people with the same diagnosis can have completely different symptoms and degrees of discomfort. Since his frequent nighttime urination was disrupting his sleep, probably causing his fatigue, I focused on that symptom along with other heat patterns I was seeing. In doing so, I also made sure to include herbs that are known to effectively support prostate health in modern research. He felt better, slept better, and that changed his quality of life completely. He had more energy to manage his diabetes and high cholesterol, and it all started with one simple question. How do you feel? Now, look, I'm not against conventional medicine. I rely on it. I respect it deeply. But I also understand how the system operates in a way that may overlook details outside the diagnostic criteria. When people feel frustrated because they don't get a diagnosis and no one can tell them what's wrong, they bounce from specialist to specialist and still don't feel better. It's not the doctor's fault. They're working in a system that gives them very little time and demands clear diagnoses. If there's no drug or clear protocol, there's often not much they can offer. That's why in my practice, I keep asking, is there anything that just doesn't feel right? No matter how small, no matter how weird it sounds. Because even when you're in that gray zone, not quite sick, but not well, this kind of integrative approach has tools that can help. It can support you through early imbalances, chronic conditions, ongoing illnesses, and even recovery. So if no one's ever asked you, where do you feel unwell? Let me be the first. Your symptoms aren't just noise. They're your body's language. And when we listen, symptoms improve and become much more manageable. The patient stories I share are composite cases based on real medical scenarios, with fictional names and details to protect privacy.